So imagine this scenario. Your amazing grandmother who's been an extraordinary role model for you, and she's now facing her mid-70s. After her granddad passed, she's been on a limited budget, money's been tight. Over the last couple months, she's been having more and more upper back pain, extending into her neck and left shoulder. There's no specific injury, but her quality of life is absolutely being affected. You refer to your favorite chiropractic physician, and as with every doctor's visit on her first appointment, she has to have an exam. But Medicare doesn't cover that. So she'll be paying somewhere between $100 and $200 for that out of pocket, even though all other major insurances do cover this. Because she has a history of osteoporosis and now a noticed excessive curvature in her upper back, the chiropractor also maybe recommends that she has x-rays to determine if he can safely treat her. But Medicare doesn't pay for the x-rays done by the chiropractor, even though all the other major insurance companies do so. So now after either having to pay out of pocket another $50 to $150 for x-rays, or the chiropractor can send her back to her primary care doctor, who, assuming they can get her in within the next 2 months, can order the same x-rays that the chiropractor wanted and could have taken himself. Of course, she's going to have to pay an additional copay there. Maybe her PCP does them, or more likely, he's going to also have to send her out for them. So that's another trip, another co-insurance. So now she brings her x-rays back to the chiropractor after 1 or 2 extra trips, and who knows how long. Now the chiropractor can work on her, but he can't work on her left shoulder because Medicare doesn't cover that, even if he works on it, even though they would cover it if an MD or a DO worked on it, even if they've never been trained to do so. So you can see why some of our senior populations may be tempted to skip out on chiropractic care and opt for the less effective and more dangerous drug and surgery route. Study after study shows that chiropractic care is highly effective for neck and low back pain. A recent OIG report also shows that 1 in 4 Medicare recipients were prescribed opiates in 2020, along with 43,000 plus overdoses. There's an opiate crisis in this country, and in part, it's because of the lack of affordable access to conservative care. Today, what I was doing in Washington, D.C. is many of my colleagues and I were on Capitol Hill discussing the Medicare Modernization Act, a bipartisan effort that will allow seniors to take advantage of the full scope of chiropractic care based on state licensure. We were met with open arms from members of Congress and their staff, and many of them didn't even realize that this was actually an issue. The current legislation is 50 years old, and it's time that be updated to reflect not only the changes in chiropractic, but healthcare in general. I would ask that if you have a loved one that is Medicare age, or if you think that you might reach Medicare age of 65 someday yourself, give your congressional representative a call and ask them if they would support this bill when it's introduced in the 118th Congress. If you need help learning how to do that, reach out to me. I'm happy to help. If you have any other questions about the Medicare Modernization Act, please let me know. Thanks so much.